Hello and welcome. If you're a dental graduate gearing up for the Emirates Dental Residency Entrance Exam, or EDRE, then you are in exactly the right place. Let's jump right into the single most important thing you need to understand to do well on this exam.
Okay, listen up because this is it. This is the core concept. The EDRE is not a memorization exam. I'm going to say that again. It is not a memorization exam. If you approach your prep thinking you just need to memorize facts, you're heading down the wrong path.
So, what's the difference, really? Well, a memorization exam just asks you to recall stuff: definitions, lists, classifications. The EDRE, on the other hand, is all about clinical decision-making. It throws you into a real-world scenario and tests your judgment, your clinical reasoning, and how you handle pressure. And this quote really hits the nail on the head. The exam doesn't care if you can define a condition from a textbook. It wants to know if you can manage it. It's always asking, what is the next best step for this patient in this situation? It's all about the sequence of your actions. And here's where it gets really tricky. You're going to see questions where 2, maybe even 3 of the answers look pretty good. They all seem clinically sound. But the whole point is that only one of them is the absolute best choice for that specific patient at that specific moment. That's the level of clinical judgment it demands. So keeping that in mind, let's talk about the toolkit we've put together for you in this free sampler. It's been designed from the ground up to get you thinking in exactly this way. Inside this sampler, you're going to find 3 main things. First, you get real EDREE-style clinical questions, the kind of scenarios and tricky options you'll face on the actual exam. Second, and this is huge, you get detailed explanations for all the options. We don't just tell you why the right answer is right. We explain why the other options are wrong. And third, there's a short, timed mini mock test, so you can start to feel what it's like to perform under that exam pressure. Okay, so having the tools is one thing, but knowing how to use them effectively, that's everything. So let's quickly go over the smart strategy for getting the most out of this. It's a pretty simple 3-step process. First, really try to answer the questions seriously. Don't just peek at the answers. Commit to your choice. Step 2, review the explanations, even for questions you got right. Understanding the why is way more important than just getting the point. And finally, step 3, start tracking your weak spots. You'll begin to notice patterns. Maybe you struggle with perio questions, or perhaps it's a specific type of case management. Now, before you dive in, I've got one more crucial message for you. This is something I really want you to remember as you start working through the questions. Listen, if you find these questions difficult, that is completely 100% normal. In fact, you should find them challenging. This sampler was written to match the real standard of the EDRE, and that exam is designed to push your clinical reasoning to its limits. Difficulty is a good sign. It means you're practicing at the right level. So, what's the end game here? Well, this sampler isn't just for practice. It serves a bigger purpose. It's a diagnostic tool to help you figure out how ready you really are. By the time you're done with everything in the sampler, you should be able to answer this one critical question with a lot more honesty and clarity. Am I truly exam ready? At the end of the day, there are really 2 possible outcomes. You'll either finish this and feel confident, like, okay, I'm on the right track, or you'll realize you need more in-depth practice. And if that's you, that's perfectly okay. It just means your next logical step is to dive into full-length mock tests to really build that mental muscle. So, with all of that said, it's time to get started. Jump into that first set of questions, treat it like the real thing, and let's see where you stand. Good luck!